Everyone suffers from imposter syndrome to some degree. And so it helps when you find people who have confidence in your abilities and mentors you respect who say, no, you can do this, you should put your name forward. My work centers on the use of therapeutic ultrasound. And specifically, we've been really interested in drug delivery to the spinal cord. Right now, we're interested in taking this technology, which is use of ultrasound and intravenously administered microbubbles to modulate the blood-brain and blood-spinal cord barriers. Really excitingly, this is now in clinical trials of the brain. I think over the next few years, we're going to see some very exciting clinical work. And hopefully with that, the preclinical and basic studies will keep up to help us find entirely new mechanisms and indications that we hadn't even thought of. Try and pick something that aligns. So even if it's not the specific project, that they come away from those 5 weeks thinking, okay, these are the kinds of tools that I'll be working with, and I already hate it, and I know I don't want to be there, or yes, this is very exciting, I'm pretty good at this, or I think I want to become good at this. Even if your project is different from everyone else in the lab, there's always knowledge sharing. Sometimes you get lucky and the first plan of attack yields really exciting results and you get to write up quickly. That's what we aim for, but science doesn't always work like that. This is research, it hasn't been done before, and if we knew the answer, it would be very boring. Understanding the contribution of your research, then not everything has to be that Nature paper in order to really advance the field. What is the useful information that's coming out of your research that might ultimately impact patients? And that's the important question.